I'm a dentist who has practiced my entire professional life, 32 years, in a rural area of Southwest Virginia in the Central Appalachians. Practiced with my husband, but when we chose a location, we actually built a building for our new practice years ago, but we actually chose a location very close to the jobs that came with dental insurance. We had a large auto manufacturing plant, and we located our practice right down the hill from that population because we knew they had good access to dental care, and lots of our patients came because we were close to them and because they had dental insurance. People are so caring in a rural community, and the opportunity to be a professional in a rural community is one that I cannot overstate. You will be called on as a dentist to be a member of your local hospital board. You will be called on as a dentist to help start up a local community bank. You will be called on to give as much of your time as you can possibly afford, but it's in areas that are going to exceed your expectations of yourself as a professional and push you to accomplish more than you ever would be able to in a larger community. Being part of a community, whether it's a faith-based community or your professional community, offers leadership opportunities in a rural setting that just aren't available to you just because of sheer numbers in urban areas. So let's talk a little bit about what you might be worried about if you chose to go to a rural practice. You might be worried that it would be harder to repay your dental school educational loans, and that's a very real concern. I know that the average indebtedness is more than I would even want to think about. It's gone up astronomically in recent years, and I know that's a big concern. There are many payback programs, both federal and at the state level, in rural communities, in federally qualified health center jobs, for instance, or even for private practitioners to start their own practice. I was a recipient of one of those programs, and it was very helpful toward paying back my loans. The other thing that you need to know is that if you have an interest in quality of life in an area where crime rate is low, tax rate is low, homes are more than affordable, property rates are bargains compared with Midtown or any other place near the city, and you can have the opportunity to raise a family in an area that is safe and beautiful and engaging in terms of outdoor activities, in terms of educational opportunities, in terms of travel, access to travel. And with the internet, you really can be as close as you want to be to educational opportunities. So there are many ways that you can work and practice in a rural area and not be penalized. So if you want to do that, there are many ways to do it. And money should not be your first worry when you think about a rural practice. Practitioners in rural communities, by and large, are extremely busy. There is not nearly as much competition for patients as there will be in urban areas or city practices. So communities will often help pay back loans. Hospital foundations or community foundations will often help pay back student loans in order to get a new practitioner into the communities. So I urge people to not just write off a rural practice out of hand, but to look into some different ways. If you really want to make it work, you can make it work. And you can have a very comfortable living with very comfortable outcomes for you and your patients, and feel like you're doing a great job toward meeting the access to care issues in this country.